In this video, I want to talk about the neurological and gastrointestinal symptoms of celiac disease. If you like the content, why not give it a like and subscribe to my channel? This is a great resource for living a gluten-free life. Hello, I'm Mike Hines from JustNoGluten.com. I feel I should give you a little warning. Some of the details in this video are a little bit graphic, and it's probably best to avoid watching during meal times. Let's talk about the primary symptoms. When most people consider the signs and symptoms of celiac disease, they're normally referring to the primary symptoms. These are usually centered around the digestive system. This is where the problem originates, and there are often painful symptoms experienced in this area. And we will get round to those later in this video. However, there are so many other symptoms that can be experienced by celiac sufferers. As so much of our health depends on our diet, the inability of our digestive process to efficiently extract the nutrients we need will ultimately impact the other systems of our bodies. Many of these symptoms seem so far removed from the problem that gluten intolerance may not even be considered as a potential culprit. Problem is, too many people have had their condition overlooked or misdiagnosed for many years, as many of the symptoms, especially in isolation, can be indicative of a range of conditions other than celiac disease. An accurate diagnosis depends entirely on the information given. It is very important when speaking to your doctor to make the practitioner aware of all your symptoms, even those that may seem unrelated to the problem. If a doctor is only called to focus on the abdominal symptoms, it is difficult to narrow down to a specific diagnosis. If presented with a cluster of symptoms, even if they seem unrelated to you, the options narrow and a more accurate diagnosis is possible. Here are some of the possible symptoms of celiac disease that are not specific to the digestive system. If you are experiencing any of these in combination with digestive systems, it may be time to ask your doctor for some tests. At least experiment with a gluten-free diet and monitor the results. If gluten intolerance is the problem, you should see some improvement in a fairly short time. Let's have a look at some of the neurological celiac disease symptoms. It is common for people with undiagnosed gluten intolerance to feel such extreme fatigue that it is difficult for them to perform their daily tasks. Obviously, this can greatly affect one's life. Since fatigue seems to get worse, a lot of people blame their age. Many people who have celiac disease complain of sleep disorders such as insomnia. It doesn't take long for fatigue to set in, being unable to fall asleep or stay asleep during the night and feeling exhausted all day long. Many celiac patients report suffering from brain fog due to ingesting gluten. With brain fog, the person has trouble clearly thinking, and it can literally feel as though a murky fog surrounds your head. For example, you may fumble while trying to complete basic household or work-related tasks. You may easily forget people's names or the right words in order to continue an intelligent conversation. And you may continue to misplace items, everyday items you use. Another symptom of celiac is migraine or headaches. Some newly diagnosed celiacs list migraine headaches among their symptoms. Thankfully, these headaches will often lessen in frequency and severity, or even totally disappear after a gluten-free diet is adopted. Let's have a look at the psychological symptoms. Undiagnosed celiacs often deal with irritability, anxiety, and depression. Some celiacs can tell if they've been exposed to gluten by how irritable they become. This particular symptom can occur within hours of exposure and may last for many days. Peripheral neuropathy. Peripheral neuropathy may be experienced, and this is a sensation of weakness in the extremities, like pins and needles, numbness. This is believed to be one of the most commonly reported neurological symptoms of celiac disease. Another symptom is restless leg syndrome. In one study, approximately 31% of patients with celiac suffered with restless leg syndrome, in comparison to just 4% of normal patients. Gluten ataxia. Some people are diagnosed with a condition known as gluten ataxia. This condition is characterized by the loss of coordination and balance which occurs when gluten is consumed. Now we come to the gastrointestinal symptoms of celiac disease. Not every person who suffers from celiac disease has gastrointestinal symptoms to deal with, but the majority of people do. One recent study found gastrointestinal issues in approximately 75% of newly diagnosed cases. Chronic diarrhea is one of the most commonly associated symptoms, and statistically it affects at least half of newly diagnosed individuals. Typically, this kind of diarrhea floats instead of sinks, has a very smelly and watery disposition, and is quite voluminous. When diarrhea is not occurring, bowel movements are often foul-smelling, large in size and pale in colour. There are a number of people who suffer from constipation with celiac disease instead of diarrhea. Some people alternate between the two extremes. Excessive gas or flatulence is also commonplace. Abdominal pain is also frequently associated with this condition. Abdominal bloating can be extremely severe as well, to the point where many individuals claim to look 6 months pregnant when gluten is digested. Acid reflux and heartburn are often reported by those diagnosed with celiac disease. Gastroesophageal reflux disease is potentially a second diagnosis and is strongly linked to celiac disease, as well as sharing many of the symptoms. Becoming lactose intolerant or dealing with frequent vomiting and nausea are other gastrointestinal symptoms that occur as a result of celiac disease. Gallbladder disease and pancreatitis can develop in undiagnosed celiacs. Many undiagnosed people lose weight due to their bodies not being able to absorb the adequate nutrition. Also, those who suffer from constipation as their primary gastrointestinal symptom may find that they gain weight and are unable to successfully shed excess weight regardless of how much they exercise or diet. Depending on the age of the sufferer, additional bowel symptoms may also present themselves. Common warning signs include unusual bowel movements and excessive gas and a distended stomach. It goes without saying, an accurate diagnosis is essential. It is estimated that approximately 95 million people are plagued by digestive issues every day. In fact, digestive complaints are one of the main reasons people visit their doctor. Since the causes of digestive diseases can be very complex and elusive, it is recommended to seek medical attention for them as soon as any symptoms arise. Often their causes are overlooked as the symptoms may appear subtle. Also, some digestive disorders may be hereditary. Reaching and identifying a diagnosis with an accurate and thorough physical background and medical history taken is vitally important. Celiac disease is often quite misdiagnosed or confused with irritable bowel syndrome. Patients of both experience the same symptoms. Best to remember, the treatment for these conditions is not the same, and therefore it is important to have a correct diagnosis in the first place in order to be able to make the appropriate lifestyle changes that will provide relief. The importance of functional digestion. Our digestive system is responsible for absorbing the nutrients, the vitamins, minerals, proteins and carbohydrates that keep us thinking, feeling and growing healthy. In addition, our digestive system is also responsible for eliminating waste and toxins from our system. A digestive disease such as celiac disease is impossible to ignore. If you do not educate yourself and learn how to adjust to a diet free from gluten, you may experience much unnecessary pain and suffering. Unresolved digestive disorders can make your life miserable. Hope you enjoyed the video and the content. I'll see you in my next video. And thanks for watching. Bye bye for now. See you soon.